Hello everyone. Today, we're diving into the world of a medication called Dostarlimab, commonly known by its brand name, Jemperli. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Dostarlimab, often recognized by its brand name Jemperli, is a monoclonal antibody that falls under the category of immune checkpoint inhibitors. Its primary function is to help the immune system recognize and attack cancer cells. Initially approved by the FDA in 2021, it's primarily prescribed for the treatment of certain types of endometrial cancer. Specifically, it's used for adult patients with mismatch repair deficient, DMMSR, recurrent or advanced endometrial cancer that has progressed on or following prior treatment with a platinum-containing regimen. Jemperli is also being studied for use in other types of cancer and shows promise in treating tumors with specific genetic profiles that make them more likely to respond to this type of therapy. Warnings: Dostarlimab comes with its set of precautions. It can cause the immune system to attack normal organs and tissues, leading to serious or life-threatening complications. Conditions such as immune-mediated pneumonitis, hepatitis, colitis, endocrinopathies, nephritis, and skin reactions have been observed. It's essential to monitor for signs and symptoms of these immune-mediated side effects and manage them promptly with corticosteroids or hormone replacement therapy, depending on the severity. Before taking this medicine. Before starting Dostarlimab, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or have had any adverse reactions to monoclonal antibody treatments in the past. Those with pre-existing autoimmune conditions should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider, as Dostarlimab can harm an unborn baby. Effective contraception should be used during treatment and for some time after the last dose. You should not take Dostarlimab if you have severe immune-related side effects from previous immune checkpoint inhibitors. It's also not recommended for those with certain autoimmune diseases without a thorough risk-benefit discussion with your healthcare provider. Before starting the medication, inform your doctor if you have ever had liver problems, lung disease, intestinal problems, or any other medical conditions. It's also essential to let your healthcare provider know if you are taking any other medications, including over-the-counter drugs, vitamins, and herbal supplements, as these can interact with Dostarlimab. Side effects: all medications can have side effects, and Dostarlimab is no exception. Some individuals might experience fatigue, nausea, diarrhea, or decreased appetite. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Additionally, serious immune-mediated side effects can occur, such as inflammation of the lungs, pneumonitis, liver, hepatitis, intestines, colitis, hormone glands, endocrinopathies, kidneys, nephritis, and skin. Symptoms can include cough, shortness of breath, abdominal pain, severe diarrhea, jaundice, dark urine, unusual tiredness, weight changes, increased thirst, changes in mood or behavior, severe skin rash, or itching. If you experience any of these symptoms, seek medical attention immediately. Furthermore, Dostarlimab may cause infusion-related reactions. Symptoms of these reactions include fever, chills, flushing, itching, rash, low blood pressure, and difficulty breathing during or shortly after the infusion. It's important to report these symptoms to your healthcare provider immediately. Interactions: Dostarlimab might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Dostarlimab. The typical dosage is 500 mg administered as an intravenous infusion over 30 minutes every 3 weeks for the first 4 doses, followed by 1,000 mg every 6 weeks thereafter. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. Never alter your dosage without consulting your healthcare provider. Avoid: while on Dostarlimab, it's advisable to avoid live vaccines and close contact with individuals who have received live vaccines. Given the potential for immune-related side effects, it's wise to report any new or worsening symptoms promptly to your healthcare provider. FAQ: many wonder about the age restrictions for Dostarlimab. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Dostarlimab. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.